So this is a really quick video that describes a low volume viral pipetting technique that we use in our lab that has been pretty effective. So you just get your sample, we use 2 microliters, and you go straight to the bottom of the tube, eject, and then slide up the side of the tube. And you can see that there's no liquid left in the tip. So step 1, you just get your sample. Like I said, we use 2 microliters, and you insert the tip into the tube. And once you hit the bottom, you eject all of your sample and immediately start step 3, which is just sliding up the side of the tube. And when you do this to help prevent capillary action, because any liquid left in the tube will cause variation in a standard curve. So this just prevent that. Traditional pipetting techniques, you go straight to the bottom of the tube, eject the sample, and then straight out of the tube, which leaves a little bit in the tip. And the other way, you can go to the side of the tube and straight out, also leaves a little in the tip. And that was just straight to the bottom of the tube. You can see there's a little bit of liquid left in the tip. And then this one is just straight to the side of the tube, where again you'll have a little bit of liquid left in the tip, which it's about 0.2 to 0.5 microliters, which is pretty big variation when you're only dealing with 2 microliters. So the reason popular pipetting style doesn't work as well is because our tubes are white, so you can't just use your visual aids to pipette the sample in without having anything left. And without sliding, just capillary action will force some of the liquid to go back into the tip, which when making a standard curve is a big problem. So here's the recommended pipetting style. The tip, you can tell there's no liquid because we slid up the side. And then this is an example of what can happen if you use one of the other techniques. And you can see there's probably about 0.2 to 0.5 microliters in the tip still. And that's, like I said, 10 to 25% variation. And when you want an R-squared value around 98, that 10 to 25% will ruin your data. So one alternative method we can do is you can dilute your virus in water, and you can try that. And all this is showing is the old technique R-squared value on the left and the new technique R-squared value on the right. And you can see the new technique high R-squared value.